Australians coming home from India may now face jail time. There are potential HIV risks in Melbourne, yet another COVID-positive security guard in Perth, and a vaccine rollout that is slower than peak hour traffic in Sydney. Our COVID response has been in the crosshairs of many experts for the past year, none more so than our frontline workers and our top doctors who are saying it's putting return travellers and all Australia at risk of further infections. Omar Khorshid is the Federal President of the Australian Medical Association, and he's joining the chorus that our hotel quarantine system is deeply flawed. Dr. Khorshid, thank you so very much for joining me. I guess all of these issues and enormous blunders by the federal and state governments prove that the hotel quarantine system in this country isn't working. So what needs to be done now, do you think?
Well, I think our federal government's right in saying that most of the time hotel quarantine works, but when you ask the question are these breaches acceptable, I think all Australians would say no, because the consequences of breaches are just so dramatic. So yes, they need to do more. The short-term stuff is easy to do. Properly protect the workers with appropriate protection against the airborne spread of the virus, making sure that every single worker has been vaccinated, fully vaccinated. Still not yet the case around the country, even 2 months into availability of the vaccine. And that's not due to vaccine availability, the fact that workers are not fully vaccinated yet. They need to stop using hotels that haven't got appropriate ventilation and put in controls such as moving COVID positive patients into one facility and keeping the negative people in the other facilities, using filters in rooms, various other controls that can make the hotels safer than they are at the moment. Of course, the bigger question is, are hotels the way forward? And that is something that we're hearing several of our state premiers pushing for, but the federal government doesn't seem interested at this stage.
Do you think that given what we've seen in WA transpire over the weekend, that call will only get louder now that, I guess we have avoided a lockdown in Perth for now, but that could change in the next, say, 24, 48 hours. Do you think hotel quarantine will be back on the menu when it comes to National Cabinet on Tuesday?
I certainly hope it's on the menu, and I hope the WA government doesn't feel it's off the hook just by pointing the finger at the federal government. There is no doubt that there is only one government responsible for the lockdown we've just had in Perth and our ongoing restrictions, and that is the WA state government. But by the same token, Premier McGowan's right in saying that we need to have a national conversation about what is the future for quarantine. We're going to need it for years, and now is the time to start building the appropriate facilities around the country.
Yeah. One point you touched on, and I'd like to return, is vaccines, and there is a hesitation around it in this country, especially now in the over 50s group, given the concern of the two deaths of two gentlemen aged in their 50s and 70s last week in New South Wales. How do we combat this and work to getting the jab into more eligible Aussies, do you think, moving forward?
We can only give Australians the information they need and make sure that we have all the public figures singing from the same song sheet. The simple reality is these vaccines are extremely safe. The virus itself is extremely dangerous, and they're the only way to protect you from the virus. So that the risk benefits are very simple, and you only need to look at India or other places like Brazil to see the consequences of being relaxed about this virus. Both vaccines that we've got available are extremely effective, they're extremely safe, and we just need to keep saying that. And I think as the rollout goes forward, more Australians will know their friends and colleagues and family that have been vaccinated, they've had absolutely no problems, and hopefully they'll have the confidence to roll up their sleeves themselves.
Yeah. Most of us now, me, myself included, get our flu shot at the chemist. What do you make of the Pharmacy Guild today calling for pharmacists to be able to administer things like the Pfizer and the AstraZeneca vaccines to customers and clients?
The pharmacy guilds are always trying to extend their reach into everyday Australians' lives for the interests of their members. And remembering the pharmacy guild represents the owners of pharmacies, not pharmacists themselves. And these are very lucrative businesses. The reality is our vaccine rollout has been closely monitored and set up by our federal and state governments because we've just got so little vaccine available, and it's important that it gets rolled out as tightly as possible. And at the moment, there just isn't spare vaccine for pharmacies. Down the track, when we have more vaccine available, it is possible that there'll be a place for pharmacies, and certainly the government have indicated that. But we need to remember too, these vaccines do have a higher rate of side effects than the flu vaccine, and we need to make sure that every place that is administering the vaccines has appropriate medical supervision, just to make sure every Australian knows if they do have a reaction, they'll be well looked after.
Yeah, for sure. Speaking of vaccines, we all got so excited when the University of Queensland began tinkering in their research lab and said that something could be on the menu. It's now being re-engineered. Have you heard how that's progressing up there?
I've not heard anything lately, but I certainly have heard from senior figures in government that they were very excited about that vaccine. It had very good results in its early trials, and they were very disappointed to have to take it off the menu for Australia's vaccine program as a result of the likelihood of false positive tests for HIV. So very disappointing, and hopefully if they can re-engineer it, it'll be another possibility because we're going to be battling this virus and potentially its new mutant forms for a long time to come.
Yeah, for sure. To WA, your home state, Dr. Khorshid, where the Premier has today cancelled nightclubs and banned the 45,000 strong crowd at the 11th hour for today's AFL Western Derby between West Coast and the Fremantle Dockers. How do you rate Mark McGowan's response to this most recent outbreak in WA?
As usual, Premier McGowan says he's acting on health advice, which is what we hear from all our premiers, all our governments throughout the crisis. But at the end of the day, it's them making the decisions, not the advisors. So it was a little confusing that the footy was still on as of yesterday, just given the strength of WA's response in previous times. And I think it was literally they were a bit scared to cancel the Derby and knowing what the fallout from that would be. But I think the further information that came through today made it a no-brainer, and he had to make that last-minute decision, which I know frustrates many West Australians. I myself was taking my son to the game, and it was all off at the last minute. But it does feel like the right decision. But I think he still in his press conference was dodging some of the responsibility, I think, for what has happened, because there's no doubt this outbreak and the last one and the one before were all preventable with things we already know about the virus and how to run quarantine, from learning from the mistakes of the other states and territories. And for some reason, WA seems to think that when things go wrong, they don't need to make changes. And, that's a very disappointing attitude. And we certainly hope to see this quarantine system tightened up as much as possible, because we need it. We have to get Australians home from overseas, and we've got to get them back from India.
Yeah, absolutely. And I guess there is another health crisis that is unfolding, that is the mental health toll that these continual protection measures following slip-ups are having on Australians. Are you hearing that this is becoming, a bigger issue as we, now stare down 18 months of COVID-19 in the community?
There's no doubt there's been a huge mental health toll of this pandemic on Australians, particularly in Victoria during their prolonged lockdown period, which of course we in Perth have never experienced. And the government recognised that, the federal government, they put some extra resources in. But the best thing we can do is protect our community, and that is vaccination. So I think the solution to avoiding lockdowns, to being able to travel more, to getting a more normal life is to get our whole population vaccinated. And I think for all those reasons, whether it be economic reasons, mental health reasons, freedom reasons, we've just got to get everybody vaccinated.
For sure. Dr. Omar Khorshid, Federal President of the AMA, thank you so very much for joining me on SHARRI today.
Evening, Jenna.